Hey guys, Dr. Matt Symons from Palm Beach Health Center. I oftentimes get a lot of questions about chiropractic care, so I'm here to answer some of the most frequently asked questions. So the questions of the week, number one, are all of your patients given the same care? And the answer is absolutely not. Everyone gets a unique tailored care plan based upon whatever, A, what their goals are and what they're looking to achieve, and B, what we find. So oftentimes if someone's coming in and they're just looking for, relief care, then we can find where the muscles are causing inflammation and try to deal with that. But more often than not, people actually want to fix the cause of the problem, so they're looking at corrective care as well. And that's when we go in and we take what are called motion study x-rays, and we can see which joints are moving properly and which ones aren't, and then going through a therapeutic process to actually fix the spinal misalignments that are then causing the muscle inflammation and pain. So we're not only taking care of the relief, but we're taking care of the correction. And third, there's a portion of our practice that's wellness. There's people who've already gotten relief and gotten correction, or people who didn't have any pain in the first place, and they're coming in for more of a wellness care. And in wellness care, we're looking to oftentimes change their lifestyle. So it might be that they're looking to talk with our functional nutritionist and deal with nutritional changes in their life, or making exercise changes, or just tweaking their stretching routine, or their mental stress, or doing brain core, or some of the other wellness therapies that we have, or taking a look at their diet in particular, or any vitamins that they might need to take, or just maintaining the spinal health that they've gotten. Because just like when you get your braces off your teeth, you put on a retainer. Oftentimes in chiropractic, you're retaining that maintenance of your spine as well. So oftentimes people who aren't even experiencing pains or aches or things like that can still benefit greatly from chiropractic care. Number two question is, can I pop my own neck? I can do that myself. Why do I need to go to a chiropractor? And this is a rough one. Oftentimes when you have let's say in your neck you've got 7 bones, and if you can crack your own neck and get them to pop, oftentimes what's happening is you've got ligament laxity or looseness between 2 of the bones, and that's the one that's going to pop. So if you feel the need to pop your neck or your own spine, oftentimes it's because one of those joints is actually stuck. But when you go and you try to manipulate your own spine, what ends up happening is the ones that already move too much move more. And that can cause instability in that joint over the course of time. And at the same time, you're not getting the one that's really stuck moving. So I would never pop your own neck, because if you create instability up there, you can create disc problems and spinal cord problems. All right, so you want to leave that alone. Number 3 is, will I be sore after an adjustment? And the answer is, you possibly could. If you haven't been adjusted before, or if it's been a really long time since your last adjustment, then chances are if you're getting a joint or muscles moving, it's kind of like going to the gym. If you haven't been to the gym in a really long time and you start getting things moving, oftentimes you can be sore after that first one or that second workout. Same thing is true in chiropractic. So you want to make sure that, to mitigate that or to minimize that, that you would either drink lots of water or take magnesium, doing things to make sure that you're healing properly. And also, make sure that you let your chiropractor know, or during the exam process, that you haven't been adjusted or haven't been adjusted in a while, so that they can maybe slowly take things, in the first few adjustments before they, work those joints, too hard. Number 4, what is a joint dysfunction or a subluxation? What is that term? Whether it's a joint that's not moving properly or a subluxation, it's a spine that's misaligned, and it can actually affect not only the local tissue, but it can actually put pressure on the nerves that goes to other organs and tissues. But if that joint is dysfunctional, then it'll actually cause faster wear and tear of that joint and the disc and the other part of that nerve as well. So definitely you want to find out if your joints are moving properly or not. Another question was, will different shoes or orthotics help my pain? And the answer is sometimes, yeah. So if you take a look at any building, when they're building a skyscraper, they spend the majority of the time in building that actually on building the foundation. So if you have a foot that's pronated, or if you lost the arch in your foot, just like the arches in your spine are super important, if you've lost the arch in your feet, it can create a misalignment in your knee, hip, and low back, and further up the chain, and create problems. So you definitely want to start at the ground up, and you can, a lot of people would benefit from orthotics. So yeah, definitely I would recommend that for a lot of people. It's easy to get checked out as well. There's chiropractors and other types of doctors who look for those arches in the feet to make sure that your gait and your stance is optimal. Next question. Will I have to keep going back to the chiropractor for the rest of my life? And the answer is, it depends. What are your wellness goals? And in short, you don't have to go to the chiropractor the rest of your life, but a lot of people do. You don't have to brush your teeth the rest of your life. You don't have to eat healthy the rest of your life. You don't have to exercise for the rest of your life. But health is a choice, and some people, only want to go to a chiropractor when they're in pain and take it in terms of short-term, relief, and others want to actually take the journey to continue to take care of their body on a proactive rather than a reactive approach, and making a chiropractor part of their healthcare regimen. We think that chiropractic care is beneficial for your overall health and for your family's health. I've been personally getting adjusted for over 30 years, and I haven't missed more than 2 weeks of adjustments in those 30 years, and it's probably one of the best ways that I've maintained my optimum health. Next question. If I'm under chiropractic care, will I still need to take my pain medication? And the answer is, it depends. I would certainly, as you're going through chiropractic care, speak with the person, if you're on prescription medications, with the doctor that puts you on those, because chiropractors don't put people on medications, we don't take people off medications. But we do is make sure that your body is functioning so that your body needs fewer and fewer of those medications. So we definitely like to work with your physician to make sure that we're taking care of you as a team. And certainly nobody has ever had pain from a lack of pain medications in their diet. No one's ever had a deficiency of pain medications. So the ideal way to do it is to make sure that you're taking care of the cause of the problem, and when you take care of that, then that pain goes away, and you can work with your physician about reducing that pain medication until you don't need medication anymore. If you have any questions, please comment in the section below, and we can get them answered in our next video. Hope you learned a lot, and here's to your optimum health.